The mission of the Grassroots Maternal and Child Health Initiative is to build the capacity of both individuals and organizations within traditionally underserved communities to bring about systems change to improve maternal and child health outcomes. The Grassroots Maternal and Child Health Initiative consists of 5 programmatic areas. Number 1, housing equity for infant health. Number 2, Mothers on the Rise. Number 3 is called Equity in Early Childhood Education. Number 4, our faith-based Maternal Child Health Initiative. And finally, our community lawyering team. The whole Grassroots Maternal and Child Health Initiative was launched with the training and mentoring of what we call Grassroots Maternal and Child Health leaders. These are women with lived experience. The whole initiative is really grounded in these women. They're the individuals that live it. They're the individuals that know what's going on in their community, that know the challenges that they're facing and their children are facing. So the first thing we did was go out and ask them and then train them to help them be very effective in changing communities and organizing their communities and being activists for their communities. It was just very important to have these women sitting at the table contributing to the decisions that we make in the initiative, because we always want to make sure we're aligned with the priorities of these women who live in these communities.
It's important to understand that the national narrative of justice-involved women or women that have experienced incarceration is they're less than mothers. In a men's institution, it's a big emphasis on rehabilitation, and rehabilitation is restoring to its original form. These women do not come from greatness. They don't come from something that we want to restore them to. So it's important to dispel the myth that it's just them. They made those choices, and so their consequences are those. Babies aren't justice involved other than through their mothers. So what we're really dealing with is empowering infant mental health through the mom. You can best serve a baby by asking the mom what she needs to be the best mom she can be.
So Indiana is one of 9 states with a prison nursery unit, which we're very lucky to have. And we're also one of the oldest and biggest because we don't have a restriction on the amount of moms that can be on the unit. And then so once a mom, or if a mom goes to prison in the state of Indiana, she can qualify to be on the nursery unit. And that just means she's able to stay on that unit when she's pregnant. So she might be released either still pregnant, or she can qualify to be on the unit if she's released before the baby's 30 months old. So that's about how long she's going to stay with her baby.
Providing maternal attachment and infant education in the prison nursery setting, it allows us to provide support and intervention to the moms and the children on the unit in a really critical period of time of child development. Those first days and months and weeks of a child's life are the most critical in determining the development of that child. It's when the majority of brain development happens. And so what's really unique about our program is that we have mom and baby together. And most of the time in a prison setting, when there are classes or education that's provided, there's learning that happens, but then you have to wait until you're back out into the community or back out home to be able to try it or put that learning to use. And so we take advantage of the fact that we have mom and baby together, and we provide a safe environment for that mom to be able to learn and to be able to put some of that learning to practice in real time. And ultimately, we hope that it increases the chances for that child to have that healthy start that they deserve. And we really use that as a model of empowerment for the moms, that everything that your baby needs is here. Your baby is having all of their needs met. Obviously, the basic needs. There's food, there's safety, there's clothing. but also there's love, there's space to play, there's space to run, there's other children to play with, other moms to visit with. And at the end of the day, what your baby needs the most is you. And you have it within you to be that. You can be that for your baby. And at the end of the day, we can't control what happened before you got here, and we can't control what happens after you and your baby leave, but we can control and influence what happens while you're here together. So let's take advantage of that and really help you and your baby develop this strong, beautiful bond with one another.
So I manage Mothers on the Rise. So I work with all of the moms and babies coming out of the Leith Nursery Unit at the Indiana Women's Prison and help them connect with different agencies and a social support team once they're in community. So I manage our coordinated system of care for the nursery unit, which includes me going into the unit to make sure I get to know the moms, I introduce them to the program, and then I'm able to coordinate a meeting with the social support team and the mom before she's released, typically over Zoom. And so when she is released, I'm also able to order her about $600 worth of clothing, hygiene products, and infant supplies. And then basically the day she's released, the social support team is activated.
The women who come into the program have multiple barriers that they're presented with when it comes to housing, education, and employment. There is an important relationship between housing insecurity and birth outcomes. Housing insecurity while pregnant increases the likelihood for various complications, including hemorrhaging, preterm birth, low birth weight, and it also increases the likelihood for infant and maternal mortality. Indiana has consistently been one of the worst states for infant and maternal mortality, and housing is a piece of that puzzle. Healthy Beginnings at Home is a transitional housing program. We provide housing navigation, rental assistance, and case management. So what that means is for housing navigation, we are able to get our participants housed in areas that work for them within an average of 37 days. And that's 100% that are served and get housed. That's in comparison to other transitional housing and homeless initiatives that it takes an average of 120 days to get about 70% of the clients housed. Additionally, the rental assistance, we cover 100% of the rental assistance as our participants are then phased to a Section 8 voucher for the sustainable rental assistance long-term after our program even ends. The case management is there to help people get connected to the voucher. They're also able to kind of mitigate some of the barriers. Common barriers include like evictions, misdemeanors, felonies, poor credit, those different things that have prevented our participants from getting housed in the past. The housing navigators they help assuage some of those issues. Yes, our participants come to us with housing issues, but it's never the only issue. Whether it's they need help getting connected to a child care voucher, they need help finding employment, they need help getting furniture. A lot of our women are starting back from nothing. And so getting them to a place where they're able to get into the program, find a rental willing to work with us, and make that place feel like home for them.
First, it's important for the legal and judicial system to be engaged with maternal and child health advocacy because maternal and child health and public health as a whole is affected in so many different areas in our life. Things like housing instability, immigration laws that might be in place that stop people from accessing health care, things around transportation, all of these different areas that touch our lives also affect our health. And so if we don't have those judicial and legal minds working towards reforming some of those outdated laws and policies or looking at the true outcomes and implications that those laws and policies that allow systems to work in certain ways, how they then affect the lives of everyday people, but especially our most vulnerable populations, which tend to be mothers and babies, it calls for a change. Society is always changing, and so our laws, policies, thus systems should always be changing to make sure that they come in line with where we are today as a society.
The program itself has had quite a few successes. Our moms, the first 25, have delivered, and nearly 80% delivered full term. The majority of single births were full term. There were a couple exceptions of late preterm. However, those still had healthy birth weights. So that was a huge success, especially considering all of our moms in our program are considered high risk. As far as other successes, even just outside the health outcomes, a lot of the moms have chosen to go back for educational purposes. I know I was invited for a graduation party this coming spring. Huge kudos for the moms who are going through this program, working on their education to really create a sustainable wage upon leaving this program.
Of the moms who have engaged with our program, their recidivism rate is 2.5%. And of the moms who chose not to engage with our program as they were released from the nursery unit is 15%, which means we've been able to really be with them through navigating their integration into community and serving as a social support to help them navigate the barriers in community. And also, lowering recidivism rate saves government dollars, reduces kind of the burden and the impact on their families, their other children, and really the community overall.
From the women who've gone through the program, we've been able to measure increases in maternal attachment, so increases in bonding and attachment between mom and baby, which is a really amazing outcome to see. And we've also been able to measure an overall increase in confidence as a parent. And we've also measured an increase in understanding among the moms of why they do things the way that they do, and why behaviors happen the way that they do. And so we've been able to measure an increase in moms having a better understanding of themselves and what triggers me as a parent. How is that impacting my child? How can I take what triggers me, which I can't always change, and make sure that I'm not then passing that on to my child? So how do I still parent this baby when I'm a human myself with my own things to work through? And so we've been able to measure an increase in those overall stress levels as a parent and understanding better as myself as a parent. And what I love about our model is that so many times as a parent, I think you're forced to feel like you have to put away your own stuff, and you have to put away your childhood histories and your baggage and your responses to situations. This is you, everything that's happened to you. You're still enough, and you can still walk this journey of being a parent and being the parent and the safe base that your child needs, even with what you've been through. Kind of let's walk that together.
It's easy to tell you it saved my life, and it impacted my life's work by seeing the hope. It brought hope. It helped me to name things that I was experiencing, and it served as a great way for me to become a bridge between the women that we serve, no matter the social determinants of health that they're individually experiencing. And it also brought about a chance to collect data that otherwise would not be getting collected. We rewire those pathways and we begin the healing process. And we rewrite our story, right? We want to be the authors, and we want to teach them that they have the pen. Their story goes where they choose for it to go from here. They are the author.
These women that have often been ignored by systems in our state are now advocating in courtrooms, in the state house, to government leaders about the rights and the privileges that should be given to every woman across her lifespan and to every child across their lifespan. It's great to hear from the families that we serve and to hear that they're getting jobs and they have homes. And this is the best job in the world. I mean, to be able to help a family reach their dreams and equip them with what they prioritize to flourish, there's nothing better to do in one's life than to do this.